Interprofessional dentistry serves as a bridge for achieving comprehensive patient care. Nowadays, there are lots of different health problems which can be tough for healthcare workers to handle alone. That's why they team up with other experts to effectively manage patient needs and provide the right treatment. The mouth is regarded as a mirror reflecting overall health, for it unveils clues to underlying health conditions. Thus, dentists are crucial in spotting this early. They work together with other healthcare professionals to ensure a holistic patient care. Now, let us hear from different healthcare professionals as they share their insights on working together with dentists in patient management through interprofessional collaboration. What is your understanding of the role of dentists in healthcare?
The role of a dentist in healthcare is to empower and promote preventive care to patients in order to avoid health problems, especially to oral health.
So, in my own understanding, the role of the dentist in the healthcare is focused mainly on oral health. And they're the one that ensures that the patient have a healthy oral health, and they also give instruction as to how we can prevent dental problems as well as how we can preserve our teeth. And lastly, they're the ones we go to when we need restorative dental services. So,
dental concerns of a person, and this of course would affect their oral and their mental health, which contributes to the overall well-being and physical aesthetic of the person.
So for me, we know that dentist is a profession or a person who is qualified to treat the patient with teeth problem or who needs any oral care. So these are the skilled and practiced professionals in repairing and doing extraction of teeth and replacing it with artificial ones. And also, they help prevent an elimination of any tooth decays, and also they are the one who also help prevent or add treatments of any diseases, especially in any malformation of the teeth, and sometimes they help them repairing it with replacing it with the new ones or an artificial ones. So they also provide education to any person or to our patient on how to take care of their teeth and to take care with their oral health for their all benefits. So that's we know that dentist is a very good profession, and we need them to have a good oral health.
For me, the role of dentist in healthcare is that they play a very important role in diagnosing, treating, and preventing oral health issues. They are also responsible for conducting dental examinations, performing procedures such as fillings, crowns, bridges, and root canals, and many others. And also they educate the patients about proper oral hygiene practices.
Have you previously collaborated with a dentist in patient management?
Previously, I have collaborated with a dentist since I have friends and family who are dentists.
in clinical setting, I think no.
No, I haven't.
As a nurse working in inpatient or working in hospital, so I haven't experienced having collaboration with any dentist, but because I work dental clinics are outpatient. So as a nurse in working in the hospital, so if the patient needs advices, so we seek them, we give them advices to refer them to the best dentist that we know in town. So because they are the professionals who are licensed and knowledgeable in doing oral care. So we have to refer them or our patient to the best professionals that who knows best about oral health, and especially if the patient needs special treatment that includes any supporting with the routine examination to advanced specialist treatment. So referring them to a dentist that allows the patient to receive care for a professional with specialized training to meet their unique needs of oral health. So we know that a dentist is a best professional for that problem.
For me, yes, I have experience collaborating with dentists in patient management. My role involves working closely with the dentist to fabricate dental prosthetics, crowns, bridges, and other devices that are customized to meet the specific needs of each patient.
Have you collaborated with a dentist in other professional contexts? If not, would you consider working with one?
I haven't collaborated with a dentist in other professional contexts, but if given a chance, I would love to collaborate with them since I myself is also part of the healthcare team, and together we can help other people, especially those who are in need, and I can also learn from them.
Yes, but that time I was still an intern. So this was during our community nutrition internship. So what we do here is, the event was called Hatag Serbisyo. So what we do here is we go to certain barangay together with other healthcare professionals like medtechs, nurses, dentists, pharmacists, physicians, and there we provide free medical services. Yes, I would consider working with them because I believe that multidisciplinary approach will really help give a quality service to our dear patient, and it will also allow different medical field to have common ground where we can complement each other and not compete.
I haven't, but we were educated about their roles in terms of clinical management, especially when they are collaborating with us SLPs.
I haven't experienced any collaboration with other dentists, but if I would be given a chance to work with them or collaborate with them, I would be grateful to experience that, especially to collaborate with other professionals, especially in different expertise.
Yes, I had collaborated with dentists in various professional contexts beyond patient management, which includes discussing and implementing new techniques or materials to ensure the best treatment plan for the patients, and also troubleshoot any technical issues regarding or related to dental prosthetics.
How do you envision your profession collaborating with dentists in patient care?
I envision myself collaborating with a dentist in patient care through exchanging informations like drug interactions, drug allergies, and also develop a plan that is very beneficial for us to achieve our treatment goals.
So I envision R&Ds and dentists collaborate in ensuring that the patient gets healthy oral health, as it significantly affects the patient's ability to receive adequate nutrition. Since digestion, specifically mechanical digestion, happens in the mouth first. Therefore, healthy oral health is very important. And also, I envision R&Ds to help dentists provide nutrition education that focuses mainly on what food to lessen and increase in our diet to preserve a healthy oral health.
So I envision us speech pathologists to be collaborating with dentists in a hospital or clinical setting, specifically with patients with CLAP or if one's dentition affects their speech. And I also envision collaborating on the process of treatment, like how the treatment would go from start to finish. So these are plans that are either 6-month plans to closely monitor the patient's dentition and how it affects their speech and overall well-being. And I also envision a collaboration with dentists in terms of supporting the structures of the mouth, which affects the patient's ability to hold in and manipulate food in the mouth. So this is in terms of swallowing. For example, if a patient that has a malocclusion, so an underbite or an overbite of the mouth, in some cases would cause anterior spillage or drooling. This can show possible difficulties in maintaining the food in the mouth and or chewing, and of course this would affect their intake of food and therefore their nutrition and their overall health and quality of life. So as you can see, there's like a domino effect even if one area is affected, and that's how I envision my collaboration between a dentist and how we would work through in that type of case in patient management.
As a nurse, I know someone who is working with a dentist, and they are called dental nurse, and they are the one who work alongside with their dentist, and they are the one who assist the dentist during their patient care or doing any procedures with the patient. So they are the one who will support the dentist with their routine examination, and also I observed that they are the one who support the dentist with their routine examination. They are the one who prepare the materials for the treatments, and they also do suctioning during the procedure, like suctioning the saliva of the patient during the procedure, and also they do recording and do appointments for their patient, and also they do sterilization. That's the most important too, because as a nurse we have to control the cross-contamination of during the dental surgery, and also they maintain or make sure to have available stocks and maintaining a standard of, as I said earlier, maintaining a cross-contamination during surgeries. And nurses also can do dental education, especially that we do also webinars in that matters, and for if they need an evaluation, they can go to their dentist.
Well, I envision collaborating with dentists in patient care by maintaining an open communication channels to discuss patients' cases thoroughly, which includes understanding the dentist treatment plan and also the patient needs, providing expertise on materials and techniques for dental prosthetics, and also ensuring that the final restorations meet the functional and aesthetic requirements of each patient. I also see some opportunities to learn and gain more knowledge while training with dentists to stay updated on any advancements in the latest technologies.
From the insights shared by various healthcare professionals, it is clear that while many haven't directly collaborated with dentists in patient management, they are open to such collaborations to promote a comprehensive patient care. Each professional sees their role in collaboration differently, reflecting their expertise. Pharmacists emphasize drug interactions, nutritionists focus on balanced nutrition, Speech-language pathologists work on speech aspects, nurses prioritize preventing cross-contamination, and dental laboratory technologists ensure functional anesthetic prosthesis. This diversity emphasizes the importance of interprofessional collaboration, which ensures thorough diagnosis and personalized treatment plans tailored to each patient's specific needs, thereby contributing to high-quality patient care.
The video presentation has obtained consent from all interviewees to feature their insights. Each participant willingly agreed to share their expertise and experiences to contribute to a better understanding of the topic, ensuring that all personal information shared in the interviews is relevant to the discussion and serves the educational goals of this presentation. Thank you.